Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be covering nursing topics. They're all randomized. They're about 15 slides. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love the video, so press that like button now so you don't forget. Subscribe to my channel if you haven't done so already, and press the red notification bell so you'll be notified every single time a new video is released. Don't forget, I'm now offering next generation NCLEX reviews, as well as consultation and tutoring sessions, one-on-one private tutoring sessions. You can reserve your spot right now by going onto my website, nexusnursinginstitute.com. And while you're there, be sure to check out the audio lessons I have available. Now, without any further ado, let's get started. Testing topics in nursing. You just gave nitroglycerin sublingual to a patient complaining of chest pain. Which is a priority to report to the nurse on the next shift? Is it the patient indicates the need to use the restroom? The blood pressure decreased from 140 over 90 to 90 over 60. Respiratory rate increased from 16 to 24. Or patient indicates that the chest pain has resolved. Correct. The most important thing that you need to report to that oncoming shift nurse is that drop in blood pressure. We expect to see a medication such as nitroglycerin bring down the blood pressure, because we know that nitroglycerin causes vasodilation, right? So it causes vasodilation, increases blood flow, which increases perfusion, increases oxygen to the tissues. Wonderful. However, look at this. The blood pressure was 140 over 90, and it went all the way down to 90 over 60. Your blood pressure range, the lowest that the blood pressure should ever be, is 90 over 60. So we're seeing this trend of it dropping. Don't you think the best thing to do is to let the oncoming nurse know so they can keep an eye on that blood pressure? Because it gets any lower, we're in trouble, right? That blood pressure gets any lower, patient can have decreased perfusion, they can go in shock. That is our biggest issue, that blood pressure dropping so low. Whenever you get a test question that's asking you about priority, your priority is always going to be Maslow's hierarchy of needs. It's always going to be physiological integrity. It's always going to be what's going to kill my patient the fastest or keep them alive the longest. So let's talk about what falls under that list. When I say physiological integrity, I'm talking about vital signs, anything outside the norm for that. I'm talking about labs, anything outside the norm for that. I'm talking about ABCs, anything outside the norm for your airway, breathing, circulation. So signs and symptoms of dehydration, signs and symptoms of a myocardial infarction, signs and symptoms of a seizure, signs and symptoms of a stroke, fluid electrolytes, anything outside of those abnormalities, glucose. And when I say glucose specifically, I'm talking about hypoglycemia, anything less than 70, right? Nutrition, anything that physically keeps your patient alive is going to be important to us. So when something is outside of that therapeutic range, that's going to be a priority to us. And so that's why the blue answer is the correct answer. Now let's look at the wrong answer choices. Before I go over the wrong answer choices, give me a second. I want to see how my students are doing on the live. Thank you, guys. You're doing great. Thank you for the roses. Okay, so let's talk about the wrong answer choices. That patient indicating the need to go to a restroom, it does need to be addressed, but is that life or death? No. How about the respiratory rate increasing from 16 to 24? Well, your normal is about 12 to 20, some books 12 to 22. So even though 24 is outside the normal range, it's higher. Let me tell you something. What will kill a patient faster? That 24 or respirations of 8? Respirations of 8, right? Because the patient's not breathing enough, they're not being perfused enough. But that 24 is not going to kill them as fast as that hypotension is. And last, the patient indicating that the chest pain has resolved. That's a good thing. Why would that be a priority for us? No. What would be a priority is if the chest pain got worse, because remember when I was going over physiological integrity, one of the things I mentioned was signs and symptoms of an MI, heart attack, that chest pain, angina. But the fact that it's getting better, that's not going to be a priority. So that's why the blood pressure drop is by far a priority for us than any of the other choices that we saw, okay? You give 150 milliliters per hour IV fluids, and an hour later, you note that the line is open and 850 milliliters has been infused. What is most concerning to you as a nurse? Is it the central venous pressure of 12 and bradycardia? Is it hypotension tachycardia? Is it coughing and oliguria? Or is it rails and tachycardia? This is interesting. Okay, very good. Most of you guys chose the correct answer, which is rails and tachycardia. On my live, I don't know what you guys were doing on the live, but let's talk about this. The correct answer is the rails and tachycardia. I want you to think about it. You're supposed to be giving 150 milliliters per hour. So in 1 hour, 150 ml should be infusing into your patient. So you start the line, you come back in 1 hour where only 150 should have infused into your patient. You walk into the room, number one, you see that line is completely open. And number two, you see 850 milliliters has been infused into your patient. What is the first thing that needs to be going through your brain? You need to be thinking of fluid overload. My patient getting too much fluid, and guess what? The fluid's going to have to go somewhere. So eventually it's going to back up and what? Going to the lungs, which we do not want, right? Because breathing, ABCs, isn't that part of physiological integrity? When I was going over that list, didn't I say ABCs were one of them? Absolutely. So what are we going to be concerned about? Rails, rhonchi, crackles, shortness of breath, dyspnea, wheezing. Okay, all of these are adventitious breath sounds that we don't want to hear. Rails, you want to know why you're hearing rails? Because there's fluid in the lungs. All that fluid that just got dumped into the patient. So the rails, we're concerned about the lungs, we're concerned about patient breathing because they cannot live without breathing. And tachycardia. Why do you think tachycardia happens? Let me tell you something. Your body tries to survive no matter what. So you have all of this fluid that's infused in such a short amount of time. Your heart is going to try to compensate. Your heart is trying to push out all this extra fluid. So we see that heart rate go up. Okay. And the fact that says tachycardia, that's increased heart rate beyond what's normal. What is normal? 60 to 100. Now the heart rate is higher than 100. We're concerned about what? Possible dysrhythmias, heart issues, right? When I was going over physiological integrity, did I not mention that? Absolutely. Because can you live without your heart functioning properly for long? No. Can you live without your heart functioning at all? Absolutely not. Let's look at the wrong answer choices. The CVP of 12, that's normal, nothing wrong with that. And bradycardia, excuse me, if the patient's got fluid overload, we expect to see tachycardia, not bradycardia. So that's wrong. Next one, where it says hypotension, tachycardia. First of all, if a patient has fluid overload, they got all these fluids. If anything, we expect to see the blood pressure go up because all of this fluid is pushing against the vascular space. We expect to see hypertension, not hypotension. So that's wrong. Choice number 3, coughing and oliguria. And on my live, most of you guys went with the coughing and oliguria. And I think you ran to it because you saw coughing and you were thinking about fluid in the lungs, which you're absolutely right. That's a problem. Patients got fluids in the lungs. They absolutely may start coughing with the fluid overload. Where you went wrong was the second part, oliguria. Let me explain something to you. If your patient has fluid overload, they've got all this fluid that they should not have in their body. Fluid came into their body too fast. Your body is going to try to survive no matter what. So if anything, what are we going to see the kidneys do? What are we going to see the bladder do? We're going to see that patient urinate more because the body's going to try to get rid of all of the fluids that just got infused into the patient. I did this on purpose, and I'm going to explain to you why. As students, you make the mistake of seeing something correct in an answer choice and choosing it because you saw one thing correct instead of the entire answer choice being correct. Let me fix this for you right now. Look me in my eyeballs when I say this to you so you don't forget. If the whole answer choice, every single word in that answer choice is not correct, the whole thing is wrong. Throw it out and go with your second best answer. Professor D said it, okay? And so the only correct answer choice here is rails and tachycardia, because with fluid overload, we do expect to see hear both, where we expect to hear the rails or maybe even crackles, and we definitely expect to see patient have tachycardia. Your patient is 2 hours post-op abdominal surgery. After taking the vital signs, what should be your next priority? So they're 2 hours post-op. You took their vitals. What is the next thing that you should do? Is it positioning the patient to the left side, supported with pillows, checking the chart to see how much fluid was given during surgery, checking the abdominal dressing for symptoms of bleeding, or monitoring the incision for signs or symptoms of infection? What's your next priority? Very good. You're going to be looking for signs and symptoms of bleeding. So let's talk about this. And I saw many of you chose infection. So let me talk about the right answer first, then we'll get into the wrong answer choices. How are you guys doing on the live? All right, very good. So the reason bleeding is the correct answer choice, whenever you get a test question about surgery, the patient had surgery, always, I don't care what type of surgery it is. I don't care if it was an amputation. I don't care if it was an appendectomy. I don't care. If the patient had surgery, you're always going to be concerned about these three things. You're going to be concerned about infection, you're going to be concerned about bleeding, and you're going to be concerned about the patient developing, a DVT or that clot moving, going to their lungs, and then developing a pulmonary embolism. Those are going to be your top three concerns whenever a patient had surgery. Okay, so Professor D, you just said bleeding, infection, and DVT or PE. Well, I saw infection and bleeding as choices. How should I know I should have went with bleeding and not infection? Here's how you know: the time. The time is your key. This patient just had surgery 2 hours ago. When did they develop enough time to have an infection? They just had surgery, right? Now, if it was 12 hours after surgery, 14 hours after surgery, whatever after surgery, after 12 hours, there's been enough time for them to develop an infection, possibly, right? Then we can start suspecting infection. We see WBCs going up. We see elevation in temperature. We're looking at the site and it's red and it's painful and it's purulent, and we're smelling foul odor coming from the surgical site. Things like that, right? We're seeing inflammation, those signs and symptoms of infection. But 2 hours after surgery, really? Come on. So that when you see those two choices, that's how you figure out what your answer is going to be. Timing is very important for that patient that's post-op. So since we're able to get rid of infection because it's only been 2 hours, our only other choice that's correct here is bleeding. So that's the first thing I want to talk to you about. Here's the second thing I want to talk to you about. ADPI, assessment, diagnosis, planning, intervention, and evaluation. You have to assess your patient before you can intervene. So with that being said, it says that you just took the vital signs. What are you going to do next? You better look at your choices to see if there's another assessment to do before you intervene. So you're doing an assessment, and let's look at these choices. Position the patient to the left, supported with pillows. That's wonderful, but that's an intervention. How are you going to do an intervention before you do your assessment when I just told you ADPI in that order? You have to do an assessment first. So that can't be the answer. Checking the chart to see how much fluid was given during surgery, that's getting information. That is a type of assessment, absolutely. But when you compare that to checking for bleeding, it's going to be checking for bleeding because, again, after surgery, your top priority concerns every day of the week is going to be infection, bleeding, and DVT or pulmonary embolism. A 19-year-old patient presents to the outpatient clinic complaining of dizziness. Physical assessment and labs are all normal. The patient's a nursing student and they report that they failed med-surg. What would be an appropriate response? Would it be, have you talked to anyone about this? Are you worried about failing out of your program? Would you like to talk about what you've been going through? Or when did you first notice a symptom? What would be an appropriate answer to your patient? So most of you guys chose, and same thing on the live, you guys both did the same thing. You guys went with, would you like to talk about what you've been going through? And as therapeutic as that is, I want to make 2 points to you about this question. Number one, you always want to ask a patient open-ended questions. Okay? The exception to that rule is if you suspect suicide, if you suspect abuse, or it's an emergency. You're running the patient into surgery and you need quick answers. The only time you use closed-ended questions, yes or no questions, right, is abuse, suicide, or you need to do a quick assessment. You're rushing that patient to surgery and you need to know, have you had alcohol in the past 24 hours? Are you a diabetic? Things like that. Other than that, you want to ask open-ended questions where they can't just say yes or no and just clam up, questions where they have to explain, all right? Because we want them talking. So with that being said, the only question here that's open-ended is, when did you first notice the symptom? That's number one. All of the other questions are closed-ended. Have you talked to anyone about this? That's a yes or no answer. Are you worried about failing out of your program? That's a yes or no answer. And then would you like to talk about what you've been going through? That's a yes or no answer. How is that therapeutic? They're going to say no. And then if you say anything to them after that, you're not respecting their choice. Now let's talk about the second point I want to make about this question. Notice they said they're feeling dizzy. You did a physical exam on them. Nothing was abnormal. You looked at their labs and nothing is abnormal. Why is it a good question to ask, when did you notice these symptoms? What is this leading us to? We're suspecting that this patient has some type of anxiety going on with failing med-surg. So the first thing we want to know is, when did you first start noticing these symptoms, right? Because we want to know, did you start feeling dizzy when you found out you had a test? Did you start feeling dizzy when you started studying for these tests? Or did you feel dizzy when you got your results and found out that you failed? We're trying to find out, okay, is this dizziness, is it really something psychological that's going on? Or were you dizzy way before this med-surg happened? Was there something else going on in your life? Because you got to ask some questions, right? But we're going to ask open-ended questions, because the more information that we get from the patient, the more likely we will to be able to help that patient. That's right, soon-to-be nurse. We need more information. Very good. Your patient with appendicitis has just been diagnosed with a perforated bowel. Which is your nursing priority? Is it to place the patient in a supine position? Is it to notify the patient's adult children? Is it to prepare the patient for emergency surgery? Or is it to administer oxygen? Very good. Is to prepare that patient for emergency surgery. Do you see what just happened? Patient had appendicitis and now it's perforated, which means we have fecal matter in what is supposed to be a sterile environment. What complication are we concerned about? Sepsis. This is a medical emergency. If that patient doesn't get surgery, and surgery soon, they will die. It's not even a question, oh, are they going to die? Yes, they will. And they're going to die a painful death. We need to get them into surgery immediately, and we need to get antibiotics into that patient. So at this point, when that patient's been diagnosed with perforation, at that point, it's between the surgeon and God. It is out of your hands. There's nothing else that you can do as a nurse. So the only thing you can do is prepare that patient for surgery. Your patient, 39 weeks gestation, is an active labor, and they say, I have to push. You note that she's 8 centimeters dilated. You should tell her to take a deep breath and bear down, or apply gentle pressure but firm fundal pressure, teach relaxation techniques, or tell her to pant with pursed lips. What should you do? Wow. Okay, let's talk about this. Most of you guys went with teach them relaxation techniques, and you guys did the same thing on the live. So let me dispel this myth that you have in your head that a woman that's going through labor, she's going through active labor, and you think that's the time that you can teach her anything. She's not going to listen to you. Okay? That's not the time to start teaching relaxation techniques. She wouldn't be able to relax even if she wanted to. So that's not going to happen. She is 8 centimeters, right? So she's right now, she's in active labor, but she's still what? In the first stage. She doesn't get to second stage until she's what? 10 centimeters dilated. So we're not going to tell her to push because she's still in that first stage. What we're going to tell her is to pant and to use pursed lip breathing. And so what that does is a couple things. Number one, it helps her control her pain. Number two, it helps increase perfusion, oxygenation to the fetus. And there's a third thing that the pursed lip does. It helps with the pain. It helps with oxygenation, but there's something else that the pursed lip does. Oh, it helps her relax as well. Not completely, but it helps her relax from the stage she's in right now, okay? Because she cannot push until she gets to stage 2, which is when she's 10 centimeters dilated. You're not going to tell her to take a deep breath and bear down. She can't bear down. She's only 8 centimeters. You better not apply fundal pressure. You're going to cause more pain to the patient. And don't try teaching her relaxation techniques. She's not going to relax. She's 8 centimeters dilated. She's in active labor. The correct answer, you're going to teach her use pant with and use pursed lips. You're teaching your patient about a new medication, Parnate. I'm not going to try to pronounce the generic, but it's Parnate, which requires further teaching. I plan to use sunblock at the beach tomorrow if the patient says this. I plan to use sunblock at the beach tomorrow. My wife and I are having pizza and wine tonight. In the morning, I'll start my diet to lose weight. Or now that I have more energy, I can go swimming. Which one requires further teaching? Very good. The wine and pizza, that's the problem. So this medication, Parnate, it's an MAOI, and with MAOIs, you can't eat anything that's high in tyramine, right? So let me put that aside. Let's say you had no idea this medication was an MAOI. Let's say you had no idea that they shouldn't have anything with tyramine, such as, pepperoni, beer, aged cheese, anything that's been pickled, anything that you'd put on a charcuterie board. They can't have because it's high in tyramine, right? Let's say you did not know that. The fact that they are on a medication and you can't have any type of alcohol with medication, you still should have chosen my wife and I are having pizza with what? Wine. You cannot have alcohol with medication. But anyway, again, Parnate is an MAOI, and the patients who are on MAOIs cannot eat anything with tyramine. So that is the correct answer choice. You're giving a dose of apresilene to your patient. That's hydralazine, by the way, to your patient that has a blood pressure of 90/60. What's your priority nursing action? Check the urine output, administer the medication, check the apical pulse for 1 full minute, or withhold the medication. Very good. So I already talked to you about vital signs, and the lowest the blood pressure should ever be is 90/60. Why would you give hydralazine to this type of person? By the way, hydralazine is not first or even second choice of antihypertensive. Hydralazine, those are the big guns for hypertension. That is a class of drug that you give to your patient after nothing else has worked. We can't get that blood pressure down, then we're going to give them the big drugs, which is hydralazine, because it should drop that blood pressure. So a patient that has a blood pressure of 90/60, you give that to them, you're going to put that patient into hypotensive crisis. You're going to withhold the medication and place a phone call to the healthcare provider, letting them know you withheld the medication. You tell them what the blood pressure is, okay? Your patient's diagnosed with hyperparathyroidism. Which symptom is most important to report? Would it be abdominal discomfort, hematuria, muscle weakness, or diaphoresis? You guys aren't really doing good today, but that's okay. That's okay. I'm here to teach you. Let's talk about this. The correct answer, guys, is hematuria. I want you to think about the pathology of this disease process. So you have your thyroid, and then you have your parathyroid, those 4 nodules right there on your thyroid gland, right? And when we're thinking about the parathyroid, what are we really thinking about? We're thinking about calcium in the blood. So if the patient has hypoparathyroidism, calcium is low. If they have hyperparathyroidism, calcium is high. They have hypercalcemia. What is one of the complications of hypercalcemia that we are always concerned about? Stones, right? All that calcium in the blood starts to clump up, gets in the blood, and patients got kidney stones, right? So the fact that we see hematuria, which we're seeing blood in the urine, we're going to be concerned about that complication of hypercalcemia. And that needs to be reported immediately, because we're going to have to do diagnostic testing, make sure the patient doesn't have kidney stones. These other choices, abdominal discomfort, muscle weakness, diaphoresis, them sweating, those are signs and symptoms of hypercalcemia. So you see that when the patient has hypercalcemia, but hematuria, that is a complication of hypercalcemia. Which one's worse? A symptom of a disease process or a complication every day of the week. Every day of the week. Now, let's say everything I just said to you, you didn't know this. This is new to you. How else should you have known that you should have went with hematuria versus anything else? You remember when we were doing the first question and I told you whenever you get a question about priority, you need to be thinking about physiological integrity. You need to be thinking about what's going to keep my patient alive. And I went over a whole list of things, right? Hemodynamic status, patient bleeding out. Can the patient live without blood? No, they can't. Right? Are they supposed to have blood in their urine? No, they should not. So the fact that we're seeing blood somewhere that it should not be lets us know possibly that patient may be bleeding out. Don't you think that's going to be a priority for us? Absolutely. So even if you did not understand that that calcium stones was a complication of hypercalcemia, even if you did not understand that hypercalcemia is caused by the hyperparathyroidism, you still should have chosen hematuria just because of physiological integrity. You guys really don't give Maslow's hierarchy of needs enough credit. They teach this to you in fundamentals of nursing, right? And you think, okay, Maslow's, but most of your test questions, I'm telling you, it's based on ABC, airway, breathing, circulation, ADPI, assessment, diagnosis, planning, intervention, evaluation, and Maslow's hierarchy of needs, especially for next generation NCLEX, baby, that is your key to pass that test. Most of your questions are based on physiological integrity. Do you know what you need to do or recognize to keep your patient alive? Don't say I didn't warn you. Your sputum culture reveals tuberculosis. While waiting for orders from the healthcare provider, what should you do? Should you transfer the patient to an oncology unit? Should you initiate airborne precautions? Should you decontaminate the patient's personal belongings? Or should you notify the patient's family that they've been exposed to an infectious disease? You guys are doing great on the live. Making me happy. Good job. Very good job. Initiate airborne precautions. You need to know that for tuberculosis, patient's going to be on airborne precautions. And just remember when it comes to airborne, those I don't want to say molecules. That's not the word I'm looking for. I'm going to use the word molecules because the word I'm looking for, I can't think of it. Anyway, they're very small, right? they're less than 5 millimeters. When it comes, and that's why, by the way, that's why, for example, someone with TB, if they cough or they sneeze, they can stay in the air for so much longer, and they travel faster because they're so small and light. Like I said, less than 5 millimeters. And so think airborne, their light is air, so very small. Where droplet disease process patients on droplet precautions, something like, influenza, they're very heavy. They're more than 5 millimeters, and that's why they only travel short distances and they don't stay suspended in the air for long. So that's very important. You need to know the difference of the diagnoses that fall under airborne versus droplet. You need to know the sizes for both, and you need to know which ones travel far distances versus short, and which ones stay suspended in the air for long versus short, for a short amount of time. And it really has to do particles. That's the word I was looking for. I was saying molecules, but particles, that's what the word I was looking for. You need to know the difference of the size of the particles and which ones drop immediately or stay suspended in the air for long. You hear your nursing assistant talking to your suicidal patient. Which statement by the nursing assistant requires immediate intervention? Would it be, let's get you dressed, or I'll stay in the bathroom with you while you take a shower, or you will be moved to a private room today, or I'll be right back with something for you to eat? Okay. And most of you guys got it correct. I will be back with something for you to eat. So you're listening to a conversation that a nursing assistant's having with your suicidal patient. Talk about you'll be back. Be back from where? A patient that is suicidal, they are on 24-hour, around the clock, one-on-one watch. They go to the bathroom, you go to the bathroom, or that door stays open. They go in the shower, you're in the bathroom while they're in the shower. Why? They have to be on 24 hours around the clock watch. Why? They're suicidal. So you cannot leave that patient by themselves to go get something to eat, because you come back and they may be, okay? Nothing's wrong with let's get you dressed. Nothing's wrong with saying I'll stay in the bathroom while you take a shower, and nothing's wrong with them having their own room. But there is something wrong with leaving them alone for even a moment. Your psych patient says to you, I have a secret to tell you, but you can't tell anyone. What would be your best response? I'll only share the information with your permission. If it's related to your care, I need to share it with the staff. We can keep it between just the two of us, or I have an obligation to maintain confidentiality about anything you tell me. What should be your response to the patient? Very good. If it's related to your care, I need to share it with the staff. And this is important concept you guys need to know for psych. Whenever a patient tells you that they have a secret to tell you, the very first thing that needs to come out of your mouth, you need to let them know. Anything that they divulge to you, if it has something to do with their care, you will share it with the staff. And you do that, when you do that, you prevent splitting, and you promote uh um interdisciplinary care for that patient. You do not keep secrets, and you let them know ahead. And if they decide they don't want to tell you, they decide they don't want to tell you, but you let them know ahead of time that you cannot keep secrets. If it has something to do with their health or their care, you're going to share it with the rest of the staff. You're teaching your patient with multiple sclerosis. It's most important for the nurse to include which instruction. Is it exercise is tolerated daily? Is it avoid overexposure to temperature extremes? Is it stretch daily as needed, or participate in social activities? Very good. Avoid overexposure to temperatures and extremes. Even though all of the other choices are great things to teach the patient, you got to think about priority. What's most important? Keeping our patient alive and keeping our patient safe, right? So think about the disease process, this pathology. What's happening? Patients got multiple sclerosis. This is an autoimmune disorder where their own body is attacking, their own immune system is attacking their own body, right? And so that myelin sheath that's supposed to protect the nerves is now being eaten away. So the patient's going to have nerve issues, so they need to stay away from extreme temperatures. That's the correct answer choice. Your patient's scheduled for hernia repair and you give Demerol and Visceral as ordered. You then notice that the consent was never signed. What should be your next nursing action? Is it cancel the surgery, have the patient sign the consent with the witness present, call the healthcare provider, or ask the next of kin to sign the consent? Call the healthcare provider. This patient cannot sign for consent because you just gave them narcotics, right? And that is a mind altering drug. It affects the CNS. So even if they signed that consent, is it informed consent? Absolutely not. The only thing that you can do is call the healthcare provider, and the healthcare provider, they're the ones who's going to cancel the surgery. You got to stay in your lane. You're the nurse. You're not going to cancel the surgery, but you're going to contact the healthcare provider. All right, guys, we're down to our last question. You're teaching your patient about their new medication, naproxen sodium. Which statement by the patient proves understanding? Is it, I must limit wine to only 1 glass at dinner? I should avoid milk and dairy products while taking this medication. I should call my healthcare provider if my stools turn black. I will crush my pills and snort them. So very good. Most of you guys got the correct answer. I should call my healthcare provider if my stools turn black. I can't believe 2 of you chose to crush your pills and snort them. Are you serious right now? So let's talk about the stools turning black, which is the correct answer choice. We understand that naproxen is an NSAID. We know that NSAIDs are hard on the stomach. We know that NSAIDs can cause ulcers, right? So if that patient's stool starts to turn dark, most likely what's happening, they're bleeding. It's the blood that's causing the stools to turn that dark color, right? Can you live without blood? No. Is it bleeding? What's the word I'm looking for? Hemorrhagic events, right? Doesn't that fall under physiological integrity? Yep, absolutely. That is the correct answer choice. 1, I have to limit my glass wine to 1 glass. No, you're on medication. You should not be drinking any alcohol. 2, I should avoid milk and dairy products while taking this med. No, actually, you can drink milk and dairy products. This med is very, very, very hard on the stomach. You cannot take it on an empty stomach. And look at the last one. I will crush my pills and snort them. I can't believe 2 of you chose this answer. But anyway, the correct answer is I'll call my healthcare provider because they recognize that hemodynamic status is very important. Patients should not be bleeding. So that is going to be the priority. Now, before I go to the next screen to see who actually won this Kahoot, everyone that's watching this video, I want to tell you thank you right now for watching this video. Those who are listening on YouTube, thank you for listening. Please do not forget, I'm now offering next generation NCLEX reviews. I'm offering one-on-one private tutoring sessions. I'm offering consultation sessions, and you can reserve your spot right now by going on my website, nexusnursinginstitute.com. And while you're there, be sure to check out all of the audio lessons I have available. Maybe you haven't graduated yet. You're actually in a nursing program and you're struggling. You need a high grade on your next test in order to move on. go check out my audio lesson. It's going to really, really help you. So guys, thank you so much for watching this video, and you guys catch me on the next video.